It is my great pleasure to introduce Dr. Steven Eastaugh, who is our guest speaker today. Dr. Eastaugh is going to address us on federal healthcare policy reform as well as healthcare economics. Dr. Eastaugh is one of a limited number of healthcare leaders who has advised the President on federal legislation and the guiding principles that he believes should be embedded in the proposed legislation. He has a relationship with the President beyond simply health policy. He is also one of a select number of people who has played basketball with him. So he's going to provide us some insights on the President's game in terms of basketball as well as on health policy. His insights on health reform go back to the Carter administration, and he's going to tell us why he believes this time healthcare reform will finally pass. Dr. Eastaugh currently teaches at George Washington University, where he is on the faculty of the Department of Health Services Management and Leadership. He is a graduate of the Harvard School of Public Health, as well as the Harvard JFK School of Government and the Harvard Economics Department. He received his doctorate in science in public health from Johns Hopkins School of Public Health. For the past 32 years, thousands of students have passed through Dr. Eastaugh's courses on health, finance, and economics, and many leaders in healthcare today were amongst his students. One leader who's not directly in healthcare, who also passed through his classes at Harvard, was Bill Gates. And he assures me that Bill Gates learned all that he knows from him. He has written 9 books, including his latest, which is Healthcare, Finance, and Economics. Please join me in welcoming our speaker, Dr. Steven Eastaugh.
Welcome to the Healthcare Reformation. You're listening to a health economist today, and as an economist is a man who gets invited to a lunch where he tells everybody there's no such thing as a free lunch. And then he eats his free lunch. Well, today we're going to address reform and how to pay for it. And we're going to talk about the 10 guiding principles behind the Obama reform plan. Before I do that, let me just say that our key goals here are to ensure accountability, to keep paperwork and administration in check, to cut red tape, and to bring access to affordable quality care to all Americans. There are 2 words that always pertain to health care reform. Traditionally, those 2 words are forever imminent. That is, 9 times in 9 decades, we have almost passed health care reform. For example, in 1917, the AMA, the American Medical Association, was the sponsor of the health care reform bill. They said this darn country we're fighting, Germany, has had national health insurance since 1883 under Otto von Bismarck, and we're going to have health care reform in the United States. Since then, there have been a number of other famous tries at health care reform, like a fellow named Roosevelt. Franklin Delano Roosevelt had health care reform, national health coverage for all, as his 6th point, behind other points like child labor law. In fact, I actually knew 2 of the individuals who helped work with Roosevelt on that. One was Izzy Falk from Yale, and the other was Wilbur Cohen, who became Secretary of HEW from University of Michigan. I got to know them in 1970. We went to national health insurance again with Truman in 1948. I was born when Truman was president. Some of you also may remember Harry Truman. He was behind by 20 points to a Republican named Dewey. And he went all over the country for 4 weeks doing 200 whistle stops of the back of a train talking about only one issue, national health insurance. He went up 25 points in the poll and he beat Dewey in that 1948 election. Jump ahead to 1965. We almost had the passage of national health insurance, but instead we came up with Medicare and Medicaid. The bill was only 1.5 pages long, and the last sentence in that bill said, "We'll leave the details up to the Secretary." Now, it's been said that my career started with the Jimmy Carter Health Bill in 1977, but that's not entirely true, because I was pleased to be a member of something called the Committee for 100 for National Health Insurance. I was a student in college in 1970, and there were 100 people advocating for national health insurance. The two co-chairmen were Walter Reuther, president of the UAW, and Edward Kennedy, a little-known senator from the state of Massachusetts, who's going to have some role to play in health care reform this summer. In any case, Walter Reuther went all around the country saying the following in 1970. America is the only country in the world in which it's easier to get shots for your dogs than it is to get shots for your children. And they did a great job trying to drum up support for health care reform. Alas, it did not pass in 1970 and 71, but the reason it didn't is because there were too many people that were wedded to one idea. You had to have the perfect plan, it had to have all the details done out in excessive detail, and it had to be perfect. We do not want this time to make perfection the enemy of the good. I'm looking for, in the foreseeable future, a good bill. Now, an example of another crack at healthcare reform that didn't exactly work and was looking for perfection was Hillary Care. Hillary's healthcare bill in 1993 suffered because it was a 1,483-page doorstop. It listed 1,000 pages of penalties, and it had nothing to get excited about. Why do I think healthcare reform is going to pass this time? Well, I'll give you one simple reason. The first 8 times we tried it, there was only one reason to do it: a moral imperative to make healthcare a right. Now we have an economic imperative to solve the healthcare crisis, because people's wages are stagnant, because healthcare benefits are weighing down the rate at which their employer can raise their wages. Government is potentially going bankrupt in the out years from the expense of healthcare. Medicare and Medicaid and other government spending can potentially, bankrupt us all to the tune of more than $1.5 trillion in the out years from now. So we care about healthcare spending. By the way, right now, this year, government is 54.5% of healthcare spending. That is, we spend $2.6 trillion this year in healthcare, and it's 54.5% government. It's not like you ever exactly get government out of the business of healthcare. Now, what's going to happen with the reform? Well, I think there's a minuet to action. And the action is, God, just to save the economy, we need to do something. Notice that how all the business leaders this morning agreed with Larry Summers, the President's chief economic advisor, that what we need to do is we need to pass reform. Otherwise, there'll be no money left for job growth or capital formation. Is it Pauline and perpetual peril? Yes, many times we think it's Pauline and perpetual peril. But those 5 committees are working. They're working together in unison for the first time in a long time in passing a bill. Is it Eliza crossing the ice? No, I don't think so. And the central reason for that is our president. Our president's style on this issue is simple, and I'll describe it to you. Our president's style is as follows. I am not fixed in concrete. I want consensus. I want fluidity. So, for example, nobody is macho about this thing, saying, well, we need to not tax health care benefits. Indeed, that's one of the ways we're going to pay for this plan, is by taxing health care benefits. Nobody is stuck up on any of the details, like should a small employer be 10 jobs or 25 workers, definition of a small employer. The federal deficit issue, when it came out in deliberations at $1.38 trillion, followed by $1.17 trillion, those are big numbers. Any way you add it up, those are big numbers. In the dance of legislation, as Woodrow Wilson called it, we are going to face some issues of serendipity here as to what's going to get passed and when it's going to get passed. But the key point is this. Because we're spending so much money in other areas, you can't be miserly towards health care and say, no, we can't afford $50 billion a year for health care. We can't afford $634 billion for the next 10 years to reform health care. So we do have to learn how to pay for this, but I don't think that's going to limit our potential in this area. Now, before we get into depth on the Obama plan, let me just tell you about Camp Washington, D.C. I'm in the state of Washington, so let me tell you about Camp Washington, D.C. Camp Washington, D.C. right now has 4 camps. The first camp is the Obama camp, together with people like Congressman Rangel, together with Senator Max Baucus, together with people like Senator Ron Wyden from Oregon, they have about 50% support. And I think the President will pick up support from the 2 Republican senators from Maine, too. They basically want the consumer exchange. They want the Obama plan I'm about to describe. The second group of people, representing about 10% of the country, is the Edward Kennedy approach. The third camp in Camp Washington, D.C., including a certain little-known congressman from Seattle, is the single-payer camp, like Canada. I'm not an advocate of this camp as an economist because I respect choice, and the one-size-fits-all of Canada doesn't appeal to me as much as the multi-payer approach of a Japan with 28 options, or Germany, which has 1,100 insurance options that the people choose, each individual German citizen choose on the internet on an annual basis. So I'm for a multi-payer approach, but there is a strong group of people who still advocate the single-payer Canadian and United Kingdom approach. I'm not one of them. And last but not least, there's approximately 10% support for the consumer-driven, market-based Republican approach. I have one old professor, Regina Herslinger, together with one friend at Stanford Business School, who are constantly going out there and promoting the idea of consumer-driven health care. And I'm all for it as far as consumer choice goes, but it certainly hasn't worked very well in their one experimental site, that experimental site being Switzerland. Switzerland was going to do consumer-driven for sake of cost containment. Switzerland was, 4 years ago, 11th in Europe for cost per capita. Now, thanks to the consumer-driven plan, Switzerland is #1 in cost per capita, and medical costs are going up at 21% per year. So Switzerland's not the best idea for reform. In fact, they are backing off consumer-driven health care quite a bit. I was recently visiting with Swiss from Basel and Zurich and Geneva, so I have firsthand knowledge of that one. What are the 10 principles for the Obama reform plan? Well, it's all based on 2 basic constructs. One is transparency. You want the consumers to know the true price of things and the true quality of care of things. And accountability. You want honest, affordable benefit plans available for all, no discrimination based on pre-existing conditions. Let's take these principles one at a time. 10 principles. Number 1, the mandates cover children, not adults, under the Obama plan. Ted Kennedy would like to make the mandate for both children and adults. Number 2, they want to create an insurance exchange to make insurance purchase honest and affordable. In the one template they have for that is the 3 years of experience with Massachusetts. Now, Massachusetts has had its problems, but it was a bipartisan bill developed by Mitt Romney, the Republican governor of Massachusetts, with an all-Democratic legislature, and it's done a rather good job defending itself with 9 stories, editorials in the Wall Street Journal defending itself against the Wall Street Journal. For example, right now in Massachusetts, they signed up 20% more people than they thought they were going to in projections, at a cost of 12% more per capita. So they do have a 32% budget variance, if you will, which they'd like to get some help with from the federal government to the tune of $860 million. But in the long run, we hope that kind of variance shakes out and you get everyone covered in Massachusetts. Massachusetts is proud to say that they've gone from being 8.5% uninsured to being only 2.6% uninsured citizens as of today. So that's considered a victory. Next one, please. Number 3. The third principle of the Obama plan, the insurance exchange includes one public plan and requires all private plans that join to cover all applicants, regardless of pre-existing conditions. Now, I must tell you with this, and with a point below it, it's important to not overdo it with the mandates. I agree with some of my conservative brethren that I talked with after breakfast today, that you need to have control of mandates. For example, not many of you know this, but in Massachusetts there are 50 mandates. And the 50th and most expensive mandate is they cover in vitro fertilization in Massachusetts. So if you want to go have a kid or if you want to be the octomom, you can do in vitro fertilization over and over again, and it has to be a covered benefit in all health plans. That's silly, because as a matter of national policy, that's too expensive. We can't afford that. Point 4. Private plans must have benefits at least as generous as public plans. We don't want no Nevada El Cheapo HMOs and no Pimp My HMO plans. The public is really tired of this. You know where I got that expression from? I met in an airport the rapper's mother, the rapper named Exhibit. I met his mother in an airport. And she is a consumer advocate, and her son has a hit TV show called Pimp My Ride about improving your ride, your car. And she has a slideshow, it's a PowerPoint show called Pimp My HMO. And people are just tired about getting ripped off on the benefit plans. The most famous one is that Western healthcare plan in which they cover 3 oncology visits a year and 1 heart operation a year. And after that, you're on your own, buddy. That's what I mean by an El Cheapo HMO. Now let me warm you up with a little joke for the day. A nurse, a physician, and an HMO manager at the pearly gates having just passed away. The doctor steps forward and he says, I'm an oncologist, I've saved hundreds of people, St. Peter, please let me in. And St. Peter lets them in. The next person, a nurse, comes up and says, I've helped thousands of people at the bedside, and St. Peter says, you can come in. Finally, the last man, the HMO manager, comes up and says, I've got countless families, cost-effective health care. And St. Peter says, okay, HMO manager, you may enter heaven, but you can only stay for 3 days, then after that you can go to hell. In all of this, the public interest in health care reform is high, but we still need to worry about unintended consequences. For example, some of my brethren on Capitol Hill that are Republicans and some ex-leaders, such as Senator Dole, who hangs out at the Safeway 4 blocks from my office, and I introduce him to some of my students, points out that the idea of such a public plan in each state may be slow-motion Medicare in 5 or 10 years. They also worry about a side effect of short-run staff shortages. But a lot of those staff shortages that you read about in certain publications weren't exactly valid and reliable as the statistics. There is no 1-year waiting list for a physician in the state of Massachusetts for a primary care visit. Number 5 principle of 10. Government provides subsidies to low-income people to buy coverage. And low income is taken here as being 300% of the poverty level. Number 6, large employers who don't contribute premium pay into a national plan. This was the idea originally of a Republican, the GOP's own Mitt Romney. And in Massachusetts, that buy-in is only the corporation paying $295 per employee per year. That's a pretty small check. In fact, that will probably be raised this year by the state of Massachusetts legislature to $500. But again, that's a fairly small contribution for health plans that are often $14,000 per family and $7,000 per individual.